Good morning, everybody. I'm Scott Michlin. It is time for our COVID-19 Community Information Program. Great to have you along with me this morning. Megan Cullip is not here at the moment, and we miss her terribly, but she'll be back again next week, of course, so stay tuned for that. And she'll also make an appearance in just a couple of minutes to talk to our guests who are going to be on the program today, including Mike Mestas, the San Juan County Emergency Manager, Laura Ann Crawford, the Northwest Region Director, Friend Presbyterian Medical Services, and Rita Abboud. She is with the Department of Health in San Juan County, of course, and so we'll be talking with all three of those special guests coming up in the next few moments right here on our program. It is week 51 that has been confirmed. Thank you very much. And here we go, everybody, but it's great to have you along with us. We want to focus on the vaccine rollout in San Juan County and in New Mexico as part of the program today, and so in order to do that, I want to pass along this, I think, interesting map that has been shared, and if you're not watching us on Facebook, YouTube, or Twitter, we invite you to do that so you can see some of the visuals that we are sharing, but it shows that in New Mexico, more than in any other state in our country, this is from the Center for Disease Control, as of March 2nd, we have given out 90% of vaccine doses shipped to New Mexico have been given to residents of New Mexico. That is the highest percentage in the nation. So again, we want to pass that along. Congratulations. They are really moving through, and as we have seen and we will hear from our guests this morning, the rollout is going fairly smoothly, and a lot of vaccines getting into the arms of a lot of people in a lot of communities around our state. So without any further ado, let me go and invite Megan Cullip to join me in our interview with our three guests on the program today. Joining us now to talk a little bit about the efforts to vaccine residents here in San Juan County. We have three guests who are on the telephone this morning. So how about that? It's like a trifecta.
And these are all really great people.
Aren't they really great people? Stoked. Mike Mestas, San Juan County Emergency Management Director, Laura Ann Crawford, Northwest Region Director for Presbyterian Medical Services, and Rita Abboud with the Department of Health. So welcome, everyone. Thank you for calling in.
Good morning.
Good morning, Scott. Good morning, Megan.
Good morning, Scott and Megan. Thanks for having us.
Thank you all for being with us this morning. I guess let's get started. Mike Mestas, maybe we'll start with you about just the rollout of the vaccines in San Juan County, because I know the Office of Emergency Management is directly involved in working with the state to kind of coordinate some of those efforts, correct?
Yeah. Good morning again. As we've spoken about prior calls, the Office of Emergency Management is that coordinating agency, and without folks like Laura Ann and Rita, we definitely couldn't do our job. We gather the information, we get.
Joining us now to talk a little bit about the efforts to vaccine residents here in San Juan County. We have three guests who are on the telephone this morning. So how about that? It's like a trifecta.
And these are all really great people.
Aren't they really great people? Stoked. Mike Mestas, San Juan County Emergency Management Director, Laura Ann Crawford, Northwest Region Director for Presbyterian Medical Services, and Rita Abboud with the Department of Health. So welcome, everyone. Thank you for calling in.
Good morning.
Good morning, Scott. Good morning, Megan.
Good morning, Scott and Megan. Thanks for having us.
Thank you all for being with us this morning. I guess let's get started. Mike Mestas, maybe we'll start with you about just the rollout of the vaccines in San Juan County, because I know the Office of Emergency Management is directly involved in working with the state to kind of coordinate some of those efforts, correct?
Yeah. Good morning again. As we've spoken about prior calls, the Office of Emergency Management is that coordinating agency, and without folks like Laura Ann and Rita, we definitely couldn't do our job. We gather the information, we get the volunteers, but they do the actual work, so they get all the credit.
Great. And I want to ask, this is probably, well, Rita or Lorianne, you guys can take it, or you both can take it. You guys are both at different sites these days. But I know that there's still a lot of trepidation when it comes to people coming down there to get these inoculations. And so just give us a lay of the land. What can somebody expect?
I can go ahead and answer that.
Okay, yeah.
Oh, and sorry, Lorianne. So, you know, our events have, we've gotten a lot of thanks about how efficient our events are. So there's really not a long wait. And I guess that could be good or bad because it, you know, it doesn't give you much time to think about it once you get here. But, you know, what we do tell people is that all of the vaccines that are rolling out are authorized by the Food and Drug Administration. They've all undergone a lot of testing, not just for, you know, how effective they are, but also for their safety. And at every event, we continue to collect safety information. There's also a program called V-Safe by the Centers for Disease Control that people can choose to sign up for that continues to monitor for any adverse events after they've received the vaccine. Most people do absolutely fine with the vaccine. It's very, very few and far between for anybody having any significant adverse effects from receiving the vaccine. I don't know what your experience has been, Lorianne.
No, pretty similar. We are seeing just some minor body aches, some fever, headache, but no real adverse reactions.
Great. And so what's the process? So, Lorianne, I believe you're at McGee Park, and of course, Rita, you're at San Juan College. I've signed up online. I get a text message, I believe, and then I show up that day. Give us a bit of a rundown on that.
So I can kind of walk through that a little bit. So I'll start with the McGee Park, and we've done a couple pretty big events out there, the last one being Saturday, and it went extremely smooth. So, you know, there's always paperwork involved even after the registration online. So people get the paperwork, and it's some very simple safety questions that the vaccinator needs to know prior to giving the vaccine. And then when it's your turn, you have a quick conversation with the vaccinator, the nurse, the MA, whomever's giving the vaccine, and give the vaccine, get your shot record, and then get your follow-up appointment or date in which you need to have your second vaccine. And then we pretty much want to just keep our eyes on you for 15 to 30 minutes, depending on some of those questions that we asked you and how you responded, just to make sure you're doing okay with the vaccine, and then you're good to go. And it's a pretty simple process, start to finish.
And efficient, too, I might add. At least it seems to be from what we're hearing. I mean, we're able to move a lot of folks through in a very short amount of time. Some of the social media posts I've noticed, I think, you know, folks are mostly very pleased with, you know, getting in, getting out. Maybe they spent 30 minutes, maybe 45, and 15 of those is that observation after the fact. So kudos to all of you. Rita, are you seeing the same thing here at San Juan College with the vaccines here on Wednesdays and Thursdays?
Yes, absolutely. There really is not much wait. We're running about max capacity. We've run about 125 to 150 people through in 30 minutes. And so we're able to vaccinate a very large number of people in a short amount of time, which keeps wait times down. And you know, we definitely couldn't be as efficient as we are without all of our community partners. And so, you know, it definitely is very much a team effort to make this happen and to be as efficient as we are. And so we're very appreciative of all of the volunteers and community partners that have stepped up to assist with the events.
Yeah, very good. It's certainly efficient, so I've heard nothing but good things about that. Mike, this one's to you. Johnson & Johnson vaccine just approved this week. Do we have any updates on when that's coming our way? I mean, there's an upside to that one. It's a single dose, so I'm assuming that's welcomed news. So what can you tell us about that?
Yeah, very welcome news. In fact, I have a call today at 1 o'clock to discuss some of that, and I think the ladies might have been contacted as well. But we had a questionnaire brought to my office a few weeks ago asking if we did get it here in our community, did we have some idea what we wanted to do with those doses. Definitely our detention centers, our homebound seniors, our special needs community, folks that can't get there, can't get out to a site, folks that we can't worry about having to do that second dose. Those are the locations or the folks that we want to get that vaccine to. So definitely we'll be working with the ladies to help get that out. And so it has arrived in New Mexico, getting back to your original question, and we're supposed to be getting it this next week, and we'll see what the ladies have to say if they've been contacted.
Very good. Thank you, Mike. And this question may go to you as well, and that would be, again, on the phases of the vaccine. We know, I think officially, we're still in phase 1B as we move through. Have you heard anything more from the state about changing things out to get to 1C? Or I think as things move along, we're hearing words from the White House that more vaccines will be available sooner than we thought, maybe now by May instead of July. What types of maybe deadlines or dates do you foresee in the future, Mike Mestas?
Yeah, definitely. The political pressure is out there to roll it on, and they definitely don't have that aspect over the states. Whereas we still are working on the 1B. Rita and I get lists daily on the numbers that still need to be vaccinated in San Juan County as they relate to 1B and even 1A. We still have some 1As on the list that we're still trying to tackle. So once we get a majority of those phases, I think Rita will agree that the State Department of Health will look at it and then move us on to the next phase. But what they don't want is 1Bs to get left behind through that DOH portal. We need to make sure that the elderly and the vulnerable are vaccinated first. So we'll eventually get there. And Rita, help me out. What are we looking, probably summer, late spring, early summer before we get to that next phase?
Yeah, so technically right now we are working on phase 1A, and just the first two tiers of phase 1B, which are the elderly age 75 and older, and then also folks who have a chronic illness that would put them at risk for severe illness if they became sick with COVID. So those are the groups that are eligible right now that we are focusing on. Certainly as more vaccine rolls into our county, we'll be able to get through those phases and tiers much more efficiently and quickly. One thing that the state is trying to do is keep all the counties in the state on board at the same phases. And so San Juan County is definitely ahead of the curve. We have over 30% of our county have received an initial dose, and about 15% have already received their booster dose, and that's for Pfizer and Moderna. And so there's other counties that are not quite as caught up to San Juan County. And so we're going to kind of be in a holding pattern until the state can move forward together. And that's just looking at a vaccine equity perspective, that we want to make sure that all of the vulnerable populations throughout the state have equal access to the vaccine before we move down the tiers to the less vulnerable folks in our communities.
Understood. Well, and I would say the reasons that maybe we're ahead of the curve is because of these three people on the phone with us right now this morning. So thank you all for your hard work to do that. Yep. I wanted to ask, too, a bit about maybe for the folks who've registered online, and that is still the way to go, right? To go to the website and get yourself registered so that when these phases do open up, that's how you're reaching out to these folks to schedule their appointments. And so that's really got to be the first step, correct, Rita?
Absolutely. Anyone who's interested in receiving the vaccine at some point, once they become eligible, we encourage them to go to the website, which is vaccinenm.org, and get themselves registered. And then all they need to do is fill out the information that's in there, and once they've been registered, just wait, and you will eventually receive a text message or email inviting you to go ahead and schedule your appointment. But you will not get that text or email if you have not registered at vaccinenm.org. So that's definitely the first step.
Very good. And Laura Ann, this is to you. We talked to you, gosh, what feels like a decade ago. I don't know. Scott looks older.
Probably April. Thank you.
Yeah, that's getting you back for your other comment.
I understand. I deserve it.
Yeah.
I'm there. Yep.
So, but we spoke to you about the program that PMS is doing to help out our transient population. And again, I mean, this Johnson & Johnson vaccine might be perfect for that population, one dose. But let's talk about this. We were using the Rimrock Hotel to house people. What's going on there? Do you have any updates? That's been a while.
It has been a little while, and that program is off and running and running very smoothly. So it is open to basically all of San Juan County, and we've even had some folks from outside of this county. Anybody that needs to have a safe place to recover and heal, and just kind of do their isolation in a comfortable environment. So we have this is a collaborative effort. This is definitely not just a PMS thing. I couldn't do it without the fire department and the alternative response unit, as well as we've gotten some employees from the state. Suzanne Seitsinger, who is overseeing the entire program now, and she's just done a phenomenal job. But again, the program was designed to have, for the homeless population, our very vulnerable homeless population that either are exposed to COVID or are awaiting the the results of their COVID test or are positive. They are able to stay in the Rimrock Hotel for up to about 2 weeks with meals provided to them and medical and behavioral health services provided to them on a daily basis. And I think that with everybody's help, this program has just really taken off and has done a great thing for our community.
That's great to hear. I'm really proud of our community and how we treat the most vulnerable among us. I think that's a testament to the type of community that we live in. So thank you, Laura Ann, and everyone who works with you on that program. It's really terrific to hear about.
Yeah.
And
so
Scott, if I can go ahead.
Yes, Mike.
Go ahead, Mike.
Just wanted to chime in. Thanks to our community as well, because at that shelter we needed water, we needed Gatorade, and some additional donations. And just a simple email and a Facebook post on the OEM site asking the community for some donations. They were overloaded with over 5 pallets of water, Gatorade donations. And again, to reiterate what Laura Ann was saying, Susie has done a phenomenal job orchestrating that whole process over there. So we thank her a lot, and our community.
Yeah, very good. Well, I speak for both Scott and I in saying that we are super grateful both to get to live in this community and super impressed by how efficient all of you have been. And so thank you so much both for your hard work out there and also for joining us today. Rita, Laura Ann, and Mike, thank you so much.
Thanks for having us. Appreciate it.
Thank you.
Yeah.
And there you go. Our guests this morning, we appreciate their time, of course, and maybe it's one of the reasons why New Mexico is leading the nation when it comes to vaccine rollouts in our state. As we mentioned, and we're showing on the screen right now where we are on the vaccine rollouts, Phase 1B, as you heard during the interview. So again, the push is on to get the vaccine into the arms of persons 75 years of age and older. People 16 plus who are at risk of COVID complications, those frontline essential workers who can't work remotely, early education and K-12 education staff, caregivers, grocery stores, food and agricultural, public transit, critical manufacturing, public health, public safety, mortuaries, indigent care, and non-hospital labs are the next in line. Vulnerable populations, including residents of the congregate settings, and then, of course, as we move into Phase 1C, that will increase the population to adults 60 plus, other essential workers who cannot work remotely, and then by Phase 2, members of the general public ages 16 plus. But as we have heard, it seems to be the rollout is moving either on schedule, maybe a bit ahead of schedule. We'll continue to keep you updated as we learn more about the phases for the vaccine rollout. But again, as you heard as well earlier, the first step, of course, is to get registered at vaccinenm.org. That is where you can put in all your pertinent information, any other health issues you may be suffering from, and that is what the state is going to refer to when they start calling people when vaccines do become available. And, of course, we've just heard about the third approved vaccine for emergency use, the Johnson & Johnson one-dose vaccine, and that will start arriving in our state in the next few days, in addition to the Pfizer and Moderna vaccines. And so the state should be working those out. We also know that the state is working with the local drugstores to maybe get their populations in that are 75 and older. We've seen some events in both Aztec and Bloomfield recently, which is another great way to get it out to folks who maybe don't have internet access or having difficulties registering and those types of conditions. There is a hotline if you do need support for the registration process, and I'll pass that along for our radio listeners, 855-600-3453, 855-600-3453. Option 0 is for questions about the vaccine. Option 4 after option 0, option 4 then for tech support about getting registered online. But that is the steps that we all need to be taking to get in line for the vaccine as they become available. This is Megan's favorite part of the show, and she's not here to share it with you, but I will share the numbers from Johns Hopkins of how things are looking in the United States, of course, and the latest numbers from this morning show that we do have a total of 28,761,027 cases recorded in the United States over these past 51 weeks. And the current number of deaths in our country from COVID-19 have now reached 518,459. And that is just a humongous number and tragic number at that. The graph in the lower right-hand corner again shows from the peak again back in December, and things are starting to level off a little bit. We've seen a lot of cases, the numbers of cases per day dropping, but now they're kind of leveling off a little bit. So I know that's concerning to some of the public health folks who are watching those numbers very, very carefully as some states start to open things back up. So that is a concern as well. Here in New Mexico, again, the numbers, cases seem to be coming down and staying there. 359 new cases across our state yesterday for a total now of 185,898. Of those 359 cases, 12 were reported in San Juan County. We've seen case numbers from daily case numbers in San Juan County in the single digits, but they've kind of been going up and down a little bit into the lower double digits. But we've now had 13,549 cases in New Mexico. Deaths in New Mexico, that actually should be 13 additional deaths yesterday. And in San Juan County, one of those was a local person. And the recoveries continue to move up as well. Another 1,527 recoveries in our state for a total now of 150,168 recoveries. Taking a look again, KSJE.com is where we get these stories to share with you. The Navajo Nation recorded a total of 20 additional cases yesterday across the reservation, 3 additional deaths across the Navajo Nation, for a total of cases now of 29,794, and a total number of deaths across the Navajo Nation of 1,187. And there are 16,124 individuals who have recovered from COVID-19 being reported on the Navajo Nation. So we share that with you as well this morning. Some of the other things we want to share, again, San Juan County has been passing along some of the average case numbers on graph form. These graphs came out again last Thursday after we went off the air, so we always like to share those with you to see where we've been and maybe where we're headed. And these are the numbers that the state uses in determining those red to green and turquoise now conditions for local counties to reopen. And so as you can see on this graph, on the averages of daily cases, The red line being the state of New Mexico, much lower than the peak there back in December. As you can see, a little bit of a rise there in early January, but since then, things have been going down steadily. The green line is the Navajo Nation cases, and the blue line are San Juan County cases. And again, both of those are heading in the right direction. So we share that with you as well. A little bit closer look here at San Juan County cases in the yellow, and the number of deaths. We are now down to, at least as of last Thursday, about 139 average cases. I would expect those numbers to be lower next week when we see this graph again. And the number of deaths down again to 8 and continuing to be low. The red line at the bottom of that straight red line along the bottom of this graph is kind of the line where we need to be to move again from the yellow where we are now, possibly into the green level, and from there, turquoise level, of course, from the state's newest reopening guidelines. So passing that along to you as well. The watch list, same as last week, just real briefly, no San Juan County businesses are on the COVID-19 watch list from the State Environment Department, so no rapid responses reported. This is updated every day, and so again, that is good news. That hasn't changed in over a week's time, which I think is fairly impressive. There have been no rapid responses here to any business or entity in San Juan County. Again, the only closure was the Home Depot store, which we've reported on previously. They have now reopened after being closed for 2 weeks. So as of February 26th, of course, Home Depot has been open. A reminder, of course, about testing. Again, we hear a lot about testing is important to find out if someone maybe is positive for COVID-19 but not having any symptoms of the virus, and maybe they are inadvertently spreading it because they don't know. So again, folks are being urged to register at curative.com to be tested and find out if you are positive or not positive, and help us stop the spread of COVID-19. So again, the COVID testing is now at McGee Park. It is open Monday through Friday, 8 a.m. until 3 p.m., and open on Saturdays from 8 a.m. until 2 p.m. And so we encourage you to register online at McGee Park, of course, and you can call 888-702-9042. And of course, the map there is how you would get to McGee Park. To enter from US 64, head over to the testing site in the parking lot there at McGee Park, and then exit out onto the County Road 5500. That would be how you would do that and get the testing at McGee Park. Let me turn. We have another guest who is joining us this morning, and I'm very excited that he has called in to speak with me this morning. Good morning. You're on KSJE. Thank you for calling in this morning.
Yeah, this is Terry Toby.
Hi, Terry Toby, the owner of Si Senor, and thank you very much. It's great to speak with you. So thanks for calling in. We wanted to talk with you a little bit, Terry, about running a restaurant during the pandemic and some of the things that have worked, some of the things that haven't worked, and maybe how things are going today since the county's been able to open back up some indoor dining with this yellow status. So that's what I have on my mind to ask you about. But so give us an idea of how things have been going this past year. I imagine it's been a struggle for you and your staff.
Well, it's been a varied struggle. We've had to lay off. We have 48 employees, and we laid off like 32 employees, so it was really tough at the beginning.
Right, I would think so. And of course, some of the openings and closings and reopenings, all that you had to follow.
Then we got to reopen again, and then of course we hired them back, and then we had to let them go again. But we've adjusted. It's just been a long battle. We're doing all we can to keep the bills paid, and we want to thank all the people at Farmington that have supported us. We couldn't have done it without their curb service. We're doing what we can do. You know what I mean?
I understand. And that's another thing to talk about, too, because you and your staff had to quickly shift from indoor dining to offering takeout and carry out, something that you hadn't done before, I don't think, the pandemic, maybe on special occasions, but...
Yeah, and then, your cost goes up, and we've tried to keep the prices down, and it doubled the load of work. to do that, and it's been quite an experience. We've tried to make it a good experience, and
Sure.
it's just part of business. It's a new way of doing business, I should say.
That's true. Very true. And so, were you able, Terry Toby, to take advantage of any of the COVID relief efforts that have been passed that we hear about for local businesses? Has that been somewhat helpful for people in your business?
We did take advantage of the PPP. We had to. I mean, that's
Sure.
that's what kept us alive. Basically, we were able to pay our employees while they were off. We did all we could do to bring them back, to help clean, and we got through with it, and we were real thankful for that, for sure.
Glad to hear that. That's that PPP, that Paycheck Protection Program that you're talking about. And so you were able to keep some of your core management group there intact, I guess, even if you had to close your doors for a while.
Yes, for sure. And well, I tell you what, it's been a tough year. I'll be honest with you. It's just been interesting for everybody. It's just amazing what this has done.
I hear you. I completely agree. And so these days now, since last Wednesday, when San Juan County went into the yellow and indoor dining resumed at 25% or 33%, if there was some training being done, have you seen a big influx of folks coming back to eat inside at Si Senor?
Business has been absolutely wonderful. We've got all of our staff back. We've hired all 48 employees back. We're going 100%. So we're seating at 33% and with 100% staff. So we're back in business. We appreciate everybody for coming in.
You bet. And I know even before the pandemic, you had been working on your outdoor patio at Si Senor, and of course, as weather permits, I imagine folks can eat outside at some point.
Yeah, we're in the mix of putting in a drive-up window. We're going to extend our patio to make it a little bit bigger so that we can stay at 6 feet apart regulations, and we're looking forward to getting that done in probably about 2 more months.
Okay, well, that sounds like perfect timing for summer, warmer weather, so.
You're just right.
Very good. Well, Terry Toby from Si Senor, I appreciate you calling in this morning, and our best to you and all of your employees. So glad to hear you be able to hire them all back, and we hope everyone continues to kind of follow the rules, if you will, so we could stay in that yellow category, maybe move into green and turquoise in the next few weeks, right?
Yep, we've been, we double cleaning, we're triple cleaning, we're trying to do our best to keep everybody safe and healthy, and we appreciate all the customers that come in, and we can't thank Farmington and all the people from all over San Juan County serving us and coming in and supporting us. So we want to big shout out to them, and thank you very much.
Well, you're welcome. And again, a good reputation. Si Senor has been in business here for more than 20 years, if I remember correctly. So
24 years on March 13th. It's hard to believe.
There you go. So that's what it takes, though, and you're resilient. So again, congratulations. Hang in there, and thank you for joining me.
All right. Thank you very much. You guys have a wonderful day.
All right. You're very welcome. That's Terry Toby. He is the owner of Si Senor Restaurant here in Farmington, my guest this morning on KSJE, just sharing a little bit about what it's taken to keep the doors open during this past year. And that will bring us to a close of our COVID-19 Community Information Program this week, everyone. I appreciate you being with us, of course. If you like the program, if it's provided some useful information, we invite you to share that with your friends on social media. You can find it on the KSJE YouTube channel, on our Facebook page, and also on the KSJE Twitter account. And we certainly appreciate you joining us each and every week. Megan will be back next Thursday, of course, and we look forward to talking with you then. Have a great week, everyone. Stay well and stay safe. This is KSJE Farmington.